Welcome to the Baby Bunting Live series. This is Season 2 and Episode 26. Tonight we're talking about all those common questions that first-time parents often ask. We've invited Belinda Joyce to answer these questions, the ones we have and also yours. Belinda is a midwife, maternal and child health nurse and author of Survive and Enjoy Your Baby. Thanks for joining us again tonight, Belinda. We're going to be covering all things newborn, so if you do have any questions, please just pop them in the comments box and we'll answer them towards the end of the session. So Belinda, let's talk about all those burning questions that first-time parents ask. To start with, do babies understand there's days do that babies get their days and nights mixed up?
Yes, they absolutely do. So if you think about where your babies come from, in utero everything's just sort of dark, and then they're born and we have day and night, and it's a really big change for them. Some babies seem to be fine with it, and other babies seem to think it's reversed, so they'll want to sleep all through the day and wake all through the night. And if your baby's doing that, there's a couple of strategies you can use where you might wake them a little bit more frequently through the day and get some more feeds in. And if you're going to do that, look for times when your baby's a little bit wriggly and squirmy in their sleep and try and wake them then, because they're much more likely to wake up and actually feed. And then at night time, just keeping all the lights dim, trying to feed them and then pop them back down to sleep and try and keep everything just really quiet, and hopefully they'll start to get, it could take a few weeks to really turn that around, but it's a common thing for a newborn baby.
Okay, so we need to get them to adjust to night time. So what would then constitute sleeping through the night for a baby?
Yeah, so everyone, I think, is just really looking forward for when their baby might sleep through the night. A small newborn baby will usually want to feed every 2 to 4 hours, and that's pretty common and normal. Every now and then we do get a newborn baby that does sleep through the night from early on, and that's wonderful, but they're definitely the minority. So even if your baby is starting to sleep for longer periods, say 6 hours, often they go to bed at an earlier time, and it's not when the parents are going to bed. So if your baby goes to bed at say 7 or 8 p.m, even if they have a really good stretch of sleep, they're most likely still going to wake you up in the middle of the night for a feed. So it is a really good idea. Some families find that a dream feed works really well. So just before the parents are going to go to bed, waking up the baby very quietly in a dim light, feeding them and quietly popping them back into the cot with no nappy change or anything, and back to bed. And hopefully you don't sort of, unsettle them or really wake them up. So just keep avoiding sort of much eye contact and speech, and often they will go back to sleep. And then hopefully their big part of their sleep, you can actually get some sleep at the same time before they wake up. So sleeping through the night might only be 6 or 8 hours really for a young baby.
And then sleeping through the night doesn't necessarily mean that parents are sleeping right through themselves.
No.
Okay. So, but my baby doesn't seem to sleep like a baby, as the term goes. It's normal. Is it normal for them to be wriggling?
Yes. So whoever came up with that, sleeping like a baby phrase, I don't think they'd spent much time with a newborn or a young baby, because babies are restless and they wriggle and they squirm. They'll often cry out in their sleep. They even open their eyes when they're still sleeping, cry. They'll sometimes burp, pass wind, all sorts of things in their sleep, and then continue on sleeping. So really normal, but a bit of a shock to most parents.
Okay. Yeah. And should we ever actually wake a sleeping baby?
Yes. So I guess the phrase "never wake a sleeping baby" came about because babies are or can be quite difficult to get to sleep at times. Yeah. However, if someone has told you that your baby needs to be woken, it's usually around feeding and a feeding plan. So if anyone was to tell you that, it is important to wake them and get those feeds in. and that's the main reason that we would suggest
And I guess
that.
particularly for premature babies.
Yes, and babies that have come back from, say, the special care nursery and those kind of babies with special needs, we want to make sure that we always do wake them up and give them their feeds.
Okay. Belinda, what are the recommendations around co-sleeping with the baby?
Yes, so look, experts actually recommend not to co-sleep with a baby, and particularly a young baby under 4 months old. However, some parents do choose to co-sleep regardless of the recommendations. We know that the safest place for a baby to sleep is in a full-size cot on their back in the parent's bedroom. And so if people are going to choose to co-sleep, it's really important just to stick to some really simple rules that make it much safer for your baby. So things like making sure that the baby's not in between two parents where it might get really hot, not underneath a doona or close to a pillow or other soft bedding. Sleeping them out on the side with a bed rail or barrier to stop them falling out is a really great thing to do as well, and making sure that the bed's not up against the wall where they might be able to fall down into that little crack in between the bed and the wall. Also, if the baby's been unwell at all or premature or come out of a special care nursery with some special health needs, we wouldn't want to co-sleep with those babies. I think that's the majority.
So that's some great rules for babies. What rules can you tell us about parents?
Yeah, look, it's really important that the parents are not smokers, that they're not using, they haven't been drinking alcohol, using any drugs, any sedative type medications, just not to co-sleep in any of those situations, because unfortunately there have been some accidents.
Okay. So another topic on from sleep is feeding. So if I'm told to feed every 3 hours, is that from the start or the end of the feed?
It's from the start of the feed, and that's because we don't know how long a feed will actually take. So the feed could be quite quick, or it could take even an hour. So it's really important that we always take that time from the start of the feed, because over 24 hours we could miss out on feeds if we took it from the end.
Okay. And for those parents who choose to breastfeed, how long is breastfeeding recommended for babies today?
Yeah, so the National Infant Feeding Guidelines suggest that exclusive breastfeeding for the first 6 months or around 6 months when introducing solid foods, and then even up to 12 months and beyond if the parent and the baby are enjoying it and happy to continue. And for those families that stop breastfeeding before 12 months, it's just really important to introduce infant formula as their main milk drink and not cow's milk at that time until they're 12 months and beyond.
Okay, so the next question is about dealing with nappy changing, and the question is green poo normal?
Yes, green poo can be very normal.
Okay.
So babies can have all sorts of different coloured poo, and it can be quite shocking for a lot of parents, especially if it's a change from what they had been having. It's really important though, if the poo is white or chalky or even really black or any little red flecks in it, that you see your health professional straight away. But most colours of poo are normal. If you're concerned, take a photo with your phone and show your maternal child health nurse or your GP or your paediatrician. We see a lot of these photos, and most times we can set your mind at ease. If we think that any referrals need to happen, then we can do that as well. But honestly, they can have very unusual looking poos.
And how many times a day do babies generally poop, and what's normal and what maybe not considered so normal?
Sure. So some babies early on especially will poo with every feed. So every time that they're filled up and their stomach starts, I guess it gets stimulated, they will pass some poo then. And other babies, even a breastfed baby, can go up to 2 weeks without pooing, and it's still not considered to be constipation. If they were bottle fed, however, we would want them to be pooing more often than that, but they will develop a little bit of a pattern. It's more important for a bottle fed baby that the poo isn't getting too hard.
Okay. Yeah. Belinda, can you spoil a newborn baby?
No, you cannot spoil
so.
a newborn baby.
Definitely didn't think so.
Newborn babies, they don't have the cognitive ability to, say, wrap you around their little finger, even though sometimes it might feel like that. They can't do that. So if your baby's crying, they need you. So you need to meet their physical needs by feeding them and giving them a safe place to be, but they also need their emotional needs met as well. So lots of cuddles. If your baby's very distressed, not leaving them to cry it out, picking them up and giving them a cuddle, soothing them a little. And also just knowing that if your baby's just having a little grizzle, they don't need you straight away. You don't have to drop everything and pick them up, and there's no need to feel any guilt. But if they're really distressed, they do need you.
Okay, so really we should replace that word spoil with just comforting a child. Yes. Belinda, so if I wanted to spoil myself and have a glass of wine, yes, should I pump and dump my breast milk, as they say?
No. Look, we don't know what a safe amount of alcohol in breast milk actually is, but it's generally accepted that 1 or 2 standard drinks very occasionally is probably safe. What we do know is that the amount of alcohol in your bloodstream is the same as the amount of alcohol in your breast milk. So pumping and dumping doesn't help. It's only time that will help that alcohol be removed from the breast milk. So it's really important to plan ahead if you think you are going to have a drink or two, and feed your baby before you start drinking, and preferably even express some breast milk earlier in the day or the day before, so that you've got that available. Yeah. Because if your baby then wants to feed quite quickly after you start drinking, we don't want them to get that breast milk with the alcohol in it. It takes, from the time you've finished a standard drink, it takes at least 2 hours for the alcohol to be gone from the breast milk. And that's based on a standard drink, which is what you would get at a hotel or another venue. But I don't know about you, but most people pouring drinks at home, most drinks are larger than a standard drink. So it's really important to know what you're drinking and how much alcohol's in it. And there's a fabulous app, a Feed Safe app from the Australian Breastfeeding Association that's free to put on your phone. And you can put in your weight, your height, what you're drinking, and it will do all the calculations and tell you when it's safe to feed your baby again. So it's a really great option.
Oh, thanks, Belinda. And whilst we're with feeding and bottles, do you need to sterilise bottles after each use?
Yes, you really do. Just because milk's a real breeding ground for germs and bacteria, we don't want your baby getting sick just from having their milk out of a bottle. So yes, every time a bottle's used, it should be rinsed and washed with hot soapy water, rinsed and sterilised. And there's a number of different ways you can sterilise, and really for the whole time they're having bottles, that should be the case, especially if they're being made up earlier to feed later, which isn't recommended, but many people do that.
Okay.
If it's expressed breast milk that's going into the bottle, there's no need to sterilise as frequently, and that's because breast milk has got its own antibacterial properties that will stop bacteria and things from occurring. So look, probably the gold standard would be, if you're fully expressing and bottle feeding your baby, to just sterilise all of the equipment once a day. But if it's just occasional, it doesn't need to be done quite as often.
Okay, so I guess just washing them in hot soapy water and rinsing well would be okay for that.
Yes.
Oh, that's interesting. Now, just talking of final comfort, and the final question that we have for you, Belinda, is keeping baby comfortable at now, certainly as the weather gets cooler. How many layers of clothing should a baby wear, and how do we test for that?
Yeah, so basically whatever we're wearing, or the amount of layers that we're wearing plus a singlet, works really well for a young baby, particularly in cold weather. That works really well. But if it was a very hot day, they might only need a nappy. And probably the best way to tell is just by putting 2 fingers down into their clothes and actually feeling if they're clammy or sticky at all, then they're probably too hot and it's worth removing a layer.
Okay. Yeah. Well, Belinda, you've certainly covered most of our common questions for tonight. Now I'll just ask if there are some questions that you've got for us tonight for Belinda.
We have a few questions. So Danielle has asked, what do you do when baby moves their hands all over the high chair to push food onto the floor? Do you continue to offer food or offer different foods until they eat something?
That's a really good question. I'm wondering what age your baby is. So if they're just starting with foods, then it's fine as long as you don't feel that they're wasting too much food. It's fine for them to do that because that is still food exposure. So they're learning, they're smelling, probably some of it might get near their mouth or in their mouth off their fingers. They're seeing the colours and smelling it. So they're still exposures. But if they're not really getting interested in eating that food, then it might be worth waiting a few days or even a couple of weeks. Really depends on the age though. If your baby's 6 months or older, keep trying. Keep trying with different foods and letting them explore those as well.
Karina has asked if you have any suggestions for toilet training at night.
Oh, we're doing an episode in a few weeks' time on toilet training. And there's quite a lot to go through with that. So can I ask you to come back in about 2 weeks' time, and we'll try for that one.
Danielle has asked, speaking of poo, is it normal for baby to have runny poos when on solids, or should they mostly be more of a solid poo?
They should be more formed when they're eating solid foods. So if they're breastfed and just having a little bit of solids, it can still be quite loose or soft, but it shouldn't really be very runny. So it might be worth having a talk to your health professional about that.
And Hayley has asked if yellow spit up is normal.
Depending on what your baby is feeding, I'm assuming they might be breastfed, and breast milk often has a yellow tinge, particularly in the first few days. The colostrum's very bright yellow, but breast milk can be quite yellow, and so their vomit or spit up can be yellow. It's important that we know that it's not bile though. So have a chat with your maternal child health nurse or your GP just to double check that. And again, that's probably a good one to take a photo of, just because it's really hard to describe exactly what it looks like.
Hillary has a 7-week-old baby. Do you have any suggestions for an infant who favours one head side, no matter whether they're on their tummy during tummy time or laying on their back? Barbie's getting a little bit of a flat head because of this. It's
a really common thing for babies, young babies, to develop a real preference one way. So there's a couple of things you can do. If your baby's sleeping in a cot or a bassinet, try turning it around the other way, so that particularly if it's up against a wall, they're going to want to look out the other side of the bassinet or the cot. The same with any play on the floor, making sure that all the interesting things that your baby might want to look at, including you, is on the other side, so that they're going to want to turn the way that they don't choose to turn very often. Lots and lots of tummy time, or holding your baby in ways, say over your arm with their head here, so that there's no weight on the back of their head, so it's not sort of encouraging that flattening even more. Anything that's really trying to turn them, so even when they're asleep, trying to reposition their head the other way if it will move really easily. But once a flat spot does develop, the head will always roll back to that flat spot when they're sleeping especially. So just trying as often as you can when they're awake. And again, have a chat to your child health nurse. There's lots and lots of exercises. If it's getting worse, there's also an option to refer on to a paediatric physio who can give you even more extensive exercises.
Belinda, thank you for answering those questions so thoroughly for our viewers tonight, and also for the wonderful insights to the burning questions that new parents often have. I'm sure that we've dispelled some myths tonight, and I'm sure that many of our new parents have taken away some useful tips and some greater understanding of their babies and what to expect in the coming months. You can see more of Belinda and her book on her website, and we will link that into our post. If you have any concerns about your baby's health or specific questions about any of the topics or questions that we covered tonight, please see your maternal and child health nurse, doctor or another appropriate health professional. We'd like to thank you all for joining us tonight, and we look forward to seeing you again soon on Facebook Live. Good night.